Hi everybody, it's Dr. Ansari. I'm going to be talking to you about vaginal pain caused by tight pelvic floor muscles. It's called levator hypertonicity. That's the medical term for it. So basically, this is kind of like a little conceptual model of what is going on. It's not exactly what's going on, but it's the best way to understand it because it is really a difficult thing to try to understand what's going on with the vagina. So this cardboard tube is your vagina, and the pink here is your muscle. These lines going through are your nerves. And so basically the nerves go from the spinal cord, they exit out, and then they have to go to the organs like your vagina, bladder, and rectum, and they also go to the muscles, and the nerves are what make everything work. So sometimes these nerves have to pierce through or travel along the muscle itself in order to get to the organ that it needs to go to. All right. So normally a pelvic floor muscle should be kind of smooth in this way. The nerves can go along without any problem. There's nothing obstructing these nerves. The muscle is nice and smooth so that when I do a vaginal exam with a finger, so if you're a patient of mine, you've already experienced this, I feel for these muscles and I push on them through the vagina because they wrap around the vagina. And I press in here to see if they cause any pain, okay? And usually it doesn't cause any pain. You'll just feel some pressure, but it's not gonna make you jump, okay? Once in a while, I'll have patients who come and see me because they're having a lot of pain with intercourse, and there are many different reasons for this. But one of the reasons might be that your pelvic floor muscles are too tight so that they create knots. And the best way to depict this is to show that these muscles here are kind of just tense, knotted up, right? And this is not normal when you compare it to the smooth muscles here, okay? So all of this tenseness and this tightness in the muscle itself causes pain, but also notice what it does to the nerves. It kinks up the nerves. And when nerves get kinked up, it creates more pain, more inflammation on top of whatever the muscle itself is also creating. And then when I do a vaginal exam and I feel for these muscles, I'll feel these tight bands. And as soon as I put a little bit of pressure on it, all of a sudden you may feel pain. And if that's happened to you, this is what's going on here, is this tightness that I had elicited or caused when I pressed on that muscle group, okay? Now, what also happens besides the muscle just getting tight and creating knots here is that it bulges into the vagina. The muscle becomes so big and bulky, it pushes into the vagina, so it actually narrows the opening or the canal of the vagina. That further adds to things like pain with sex or intercourse. Now, not only do you have tight bands and knots that the penis is going to rub up against, it's also got to go through a tighter vagina, a smaller vagina, okay? And that then adds another level of pain during intercourse. Sometimes this type of knotting creates a continuous, constant pain. So it's not just when you have sex, it may be just when you're sitting around doing nothing. You're still having pain. Sometimes it flares up with certain exercises or certain movements. So a lot of times these pelvic floor muscles are found to be tight. Okay. So what do you do for this? The number one therapy or treatment is pelvic floor physical therapy. These are not the physical therapists that, help you with your shoulder or your knee. These are specialized pelvic floor physical therapists who are certified to work with the pelvic muscles, the pelvic organs, to deal with pelvic problems and pelvic organ muscle problems. So they will work with you to try to pretty much smooth out this muscle. It's easier said than done. I'm oversimplifying it. There's a lot involved in this. So that's why seeing a pelvic floor physical therapist is crucial in your treatment plan, and why I've sent you to one, because without one, you're not going to know how to relax these muscles. All right? Relaxation of the muscle is not doing Kegels. In fact, Kegel exercises or squeezing those vaginal muscles is going to cause worsening of your pain. It has to be the opposite. These pelvic muscles are super deep. They're hard to connect with your mind, okay? So it takes a lot of training and coaching with a physical therapist to help you get through that. So the physical therapist will work with you to learn, so that you learn how to relax these muscles, and over time they'll smooth out. You have to keep doing these exercises at home though for the long term, because as soon as you stop doing them, it's possible that they're just gonna scrunch up again, right? Sometimes, along with pelvic floor physical therapy, I also do trigger point injections, and you can find other gynecologists or urogynecologists that do these. They're injections that we put in directly through the vagina to try to get to the muscle, and it helps decrease the inflammation and helps it kind of relax somewhat, or release that knot. We do it alongside pelvic floor physical therapy. That's the ideal approach, or the way to do it. Doing trigger point injections by themselves can give some short-term success, but not usually long-term success in terms of having long-term improvement. You really need to pair it with pelvic floor physical therapy. Alongside trigger point injections, or rather not alongside, but alternatively, you can do Botox injections as well. So it's, one or the other sometimes. Usually trigger point injections are the first set of treatments that we do on top of pelvic floor physical therapy. I hope that helps in understanding the pelvic pain that's caused by pelvic muscles.